How did I recover? We're here with our first video in our series. In this series, we'll talk about how patients recovered, procedures in cardiology and interventional cardiology, and how patients achieved healing. Ready? Starting first video with patient showing early signs of cardiovascular disease. This patient was one of those diagnosed with cardiovascular disease at a young age. Our patient had no serious complaints. Actually, there was. Due to smoking, he attributed complaints to smoking. He has difficulty breathing due to smoking. He thought his chest hurt climbing uphill due to smoking, but it's not. In fact, there was a cardiovascular disease. And there was not any problem in the F4 test that was conducted during our patient's regular checkup. Patient easily completed exercise test. Due to high risk factors, family history, high cholesterol, and years of smoking, we performed virtual angiography to assess patient's condition post-test. In virtual angiography performed, stenosis observed in two patients' arteries. As stenosis in these two veins is severe, we decided to visualize patient's vein with angiography. Our patient's main artery is like this, no critical bottleneck. Virtual angiography showed over 50% stenosis in this area. But we didn't see such a critical shortage in the standard angio we made. So while VR can be a good tool for ideas, it may not give a definite result in moderate and advanced levels of narrowness. Now we're showing the patient's back vein. Look, we found a critical narrowing in a collateral vein branching from the back vein here. One of the main causes for patient complaints. Sadly, this congestion didn't appear in the virtual angiography. I mean, what I'm trying to say is, AI can give ideas but can never provide a definite witness. A node is always the definite witness. Here you can see the right vein of our patient. There was a long stenosis in the right coronary artery. It may seem severe virtually but not critical. Your intention? Your outcome? When we accessed the patient's main artery, we saw that the other two arteries were severely blocked. Look, we opened artery nicely with stenting procedure, eliminated risk. A young patient who smokes heavily almost had a heart attack, but thanks to virtual angiography and standard angiography performed afterwards, he survived. The message I want to convey is this. In high-risk situations like heavy smoking, male gender over 40 years old, and high cholesterol levels, virtual angiography can be performed at certain intervals along with the F4 test for individuals with severe cholesterol diseases. Secondly, don't say that I have no complaints. If your risk factors are high, be sure to get examined. Because heart diseases may not always give loud complaints. We can't know what it is until you get examined. Without vein checks, no visibility, no fear of crisis. If we don't look, we can't see anything. So what are we saying? We are afraid of our patients coming late. Early diagnosis and timely intervention are life-saving in cardiovascular diseases. Don't forget to subscribe to our channel and turn on notifications to see how I recovered in our files about our patients' treatment. Goodbye.